Hi, Chhavi, and welcome to the AI ML show.
Hi, Swati. Thank you so much for having me over. It's such a great opportunity.
Thank you. Thank you. So, today I want to start off with your superhero story. Like I like to say, how did you start off, or how did you start your career journey? How did you end up working on artificial intelligence and pathology and so on? So, tell me a little bit about your career trajectory.
To say it simply, I'm a nerd. And that's how my journey started. So, since my childhood, I've been very interested in science. I had an older sibling who was very fascinated by science, and I think she sort of passed on that interest to me. So for that, I went to college to do my major in chemistry with honors. I loved that, and I still have a passion for chemistry, but I did not enjoy the smells in the lab as much. And at that point, I was exploring the space of biological sciences a little bit more. And I decided to do my master's in biotech again, getting inspired by my sister who was already doing her master's and in a little bit PhD in microbiology. So I did that. That was very exciting, though I was in a resource limiting setting when I did my master's. So it was a little bit frustrating, a lot more than usual scientists. But that still did not deter my interest. So I decided to go for a PhD, which I completed in molecular biology here in the US. And vet research excited me still. I went for a short postdoc at the NIH, to be specific, at National Cancer Institute at Fort Detrick. And that's when I started writing and reviewing and editing extensively. And that was a career pivot point where I explored scientific writing and editing as a career path. So that was a huge transition. For 6 months, I built my CV to land a job in that space. And I was very fortunate to be hired as scientific editor at the American Society for Investigative Pathology, or ASIP, where I'm currently still working. And I started scientifically editing two of the journals that they publish. Currently, I'm working as Director of Scientific Outreach at ASIP. My real journey or my introduction to AI has been very recent. Don't judge my age. I know I have a long professional career behind me, but my introduction to AI just happened in 2019. And that is through ASIP managed journals. One of the journals, the American Journal of Pathology, for that journal, we expanded the scope of the journal to include a topic category on AI and computational pathobiology. And I knew nothing about it. So essentially, I took it upon myself to explore resources, to learn more, to read. And in the process, I started attending AI related conferences that had tracks on healthcare or pharma. And this was summer of 2019. And by way of me attending those talks, it was very evident that back then, at least a couple years back, in the talks, one key element was missing, which is the ethics and regulation of AI in the space of healthcare and pharma. So it almost became a passion. I actively started networking and networking with folks who had been doing anything in that space at that time. And it's been a short period of 2 years, but I have made many contacts and connections in this space. People are very welcoming. They welcome new perspectives and ideas. And I have actually collaborated extensively beyond my work in this space. And I'm very proud of that. Proud of that collaboration with
Like you
everyone
should
from this
be, like
space.
you should be very proud of all your achievements.
Yeah, so it's pretty much their contributors, global leaders who I'm working with, and their initiatives such as working groups to shine light on algorithmic bias, the misuse of AI in the healthcare ecosystem, educational pieces like white papers and mini reviews that I'm working on, documents that come up with recommendations and primers. So there's a whole array of things. And of course, I have it's something that I'm excited about and I do for work, which is putting together conferences and events. And I've been very fortunate to be able to put forth some AI ethics in healthcare events to raise awareness and to apprise people of the challenges in the field and to prime people and even make them aware of what's happening for good and what are the challenges.
Absolutely. That's amazing. It has to be. I think there's a long way. A lot of conference topics have come about ethics in AI. Like I said, I was involved in one of the authoring of one of the frameworks for the government, but we have a long way to go in terms of spreading awareness and education. But I also want to appreciate one of the points you said, right? You took it upon yourself to educate yourself. And I like to say that I'm very grateful that we are in this era of the internet compared to the early 80s or early 90s where we didn't have the resources. So one of the career pivot points for you was one when you moved into the world of pathological, sciences, but also when you got introduced to AI and furthermore ethics in AI. I mean, although I'm a technologist, but I think we're all life learners. Basically,
Absolutely.
I think the takeaway is that if you're a life learner, you pivot your careers at multiple stages in your life or your career trajectory and career journey. So thank you for that. My next question is a little focused on what are some of the AI trends that you're observing, especially in healthcare? I'm also in the field of healthcare. And there are so many use cases. It's like the sky is the limit. At the same time, how do we balance between ethical usage of these applications and have that human in the loop as well and have a human-centric design? So tell me, what are some of the exciting AI trends you've been observing?
So like you mentioned, there's a bunch of things that are happening in the AI space, right? And most of them are exciting. I know a lot of them are depressing too, but I don't want to shine light on those today. Healthcare, equitable and accessible healthcare, that is something very close to my heart. So I would just touch upon that segment. And I know that COVID-19 has laid out unprecedented challenges for everyone. But when it comes to the healthcare ecosystem, it has really been sort of a silver lining in helping folks in the healthcare sector embrace innovation. So just taking the example of COVID-19, some of the trends that I have been very excited about has been the huge uptake of telemedicine, something, that had been offered for so many years, but people were reluctant to use it or utilize it to the full potential. I hate the word using triaging along with patient, but patient triaging, for example, now AI is being used for that. And I'm very excited about that because that allows the nurses and healthcare professionals have the time to actually connect with the patients, to fulfill the passion that they went into the system for. We have already seen that we were able to expedite the manufacture of vaccines and even, assign vaccine rollout so masses can get that. And AI has helped us in getting there. A bunch of companies are now looking at drug repurposing, and they're like cocktail treatment given to COVID-19 patient. So that has been an exciting area as well. One thing that I absolutely love, and in my interactions with physicians throughout the world, what I have found is that international collaboration and safe data sharing practices have come into being to bring together bigger clinical trials and studies to combat this pandemic. And that's something that I have been very excited about. Another thing, I mean, I'm going to take this with a little bit of grain of salt, but I'm still excited about the big tech's newfound interest in the healthcare space. Or Alphabet's Verily had been around for a while, but Google's venturing into Google Health. We have Amazon Care now coming. I'm not going to say much on that, but I'm very excited about Microsoft venturing into the healthcare ecosystem, especially with the recent acquisition of Nuance. So yeah, there's a lot of exciting stuff happening just in the healthcare space that I'm following closely and I'm very excited about.
Yeah, you touched upon a lot of things that excite me. Two things is telemedicine, right? So I think citizens and general public have always wanted it, because I remember 3 years back, I was availing telemedicine that was offered at the healthcare provider, but they saw me on the telemedicine screen for like 5 seconds and they're like, come into office. But today, I think the main thing is that always citizens wants to adopt what is convenient for us, but the main thing is healthcare providers are adopting them, and regulators have to catch up, and they have already caught up a little bit, but they have to catch up some more. So I'm also excited about that. And the second thing, I know you mentioned big tech. How much ever it's that love-hate relationship with the big tech, right? But because healthcare, especially insurance and in the United States, is at the cusp of disruption. And it needs to be disrupted in a big way and bring down healthcare costs. And I think only big tech can do that, especially disrupting the very, very rigorous and established healthcare system, which is very opaque. Because I remember a few years back, if I went for my C-section, I had no idea how much it's going to cost me, although I was paying this premium for healthcare insurance. So I think, yes, how much ever we hate them, big tech disrupting will open doors for a lot more startups. And I think the costs are going to come. I feel in the next 5 years, it's going to be commoditized, especially for millennials, younger people. Why do you have to pay a hefty healthcare insurance if it's just an e-visit once a year?
Yeah, that's absolutely because of the reason there are so many entities that have plugged themselves inside the healthcare ecosystem for their ulterior motives.
Exactly.
Yes, that makes the cost of healthcare go up. So it's the first step, big tech disrupting those established ecosystem to make it a little bit more transparent for people to identify what's needed and what needs to be weeded out.
Exactly. And then I'm thinking that will pave the way, one, for regulation to catch up faster. We already have HIPAA, but I think telemedicine and even integrating AI and sensor data is a huge trend that we are observing. I think additional regulations will catch up very quickly. And
absolutely, they have to, Swati. There is no other way.
There's no other choice, because there are digital natives who don't want to visit the doctor's office, and even if you have an appointment, you have to wait from anywhere between half an hour to 2 hours, right? So nobody wants to do that, especially the digital natives. So it's going to happen.
Yeah, and the stakes are too high for us not to put regulations ahead of time.
Absolutely. Awesome. So we seem to be on the same page there. So I know you have spoken a little bit about your projects, but is there one or two specific projects you want to highlight that excite you in the space of AI ethics in healthcare, or in general AI in healthcare?
Yes. My mission is to provide accessible and equitable healthcare to masses. One of the projects, and I cannot unfortunately go into the details of the project because it's a very closely knit working group that's working on it. And we are building a case against a big provider here in the US healthcare ecosystem to expose the extent of their contribution in exacerbating the existing inequities. But that is something very close to my heart, and hopefully in a couple of months I would be able to share some of our findings, and probably you'll even see the outcome in the open in the coming months.
Thank you for sharing.
Yes, absolutely. I'll let you know when that happens.
Absolutely.
Education is something very close to my heart, and I did not mention that earlier. So, one of the things that I have been doing in the digital pathology arena had been to collaborate with experts who are using digital technology uh, eh, to educate the masses. And it's been through a bunch of mini reviews and white papers, concept papers, which have been on the rules of engagement between academia and the industry, uh, AI ethics in pathology, education in digital pathology, or just the challenges associated with using different digital displays in pathology, for example. And another thing that I'm very excited about, and it's close to my heart, is putting together events like I mentioned. So I recently did uh, a segment on AI ethics in healthcare, and there were some elements of uh, integrating the context of COVID-19, because it has definitely had an impact on the healthcare ecosystem
Mm-hmm.
and the way we think and react to anything and everything. But for 2022, I'm putting together a session on narrowing the deep learning divide in pathology with responsible algorithms.
That's amazing, amazing.
Thank
Once
you.
again, kudos to all the exciting stuff and the good work that you're doing. And we do need more and more women to participate and diverse perspectives to participate in this discussion. So thank you for that.
You're
So
welcome.
my last question I have is that for people aspiring to know more about AI or how to contribute, are there any advice or tips that you want to share? For example, how can they contribute to writing to white papers or any other collaborative efforts?
Sure. I mean, the first thing I want to say to anyone and everyone who wants to move into this field is to believe in yourself. When I got so passionate about AI ethics and regulation of AI in healthcare system, I was discouraged by folks who are very close to me even, because they wanted me to keep building my skills in, in the domain that I was in, because they thought I was going to excel there. There was no need for me to pick up something new. So I would just say, believe in yourself. If you're passionate about something, just go for it. And, a collaboration is an email, an in-mail, a message, a phone call, a ping away. I'm just amazed about how collaborative people are in this community and how welcoming they are of the diverse perspectives people have to bring to the table. And trust me, all perspectives matter. So I
Mm-hmm.
would highly encourage you, if you see something that excites you, look around who are the people who are working on that, or who have done something, or maybe willing to do something just like yourself, or exploring possibilities, and connect. I mean, sky's the limit. You'll find so many collaborators. And writing is easy for some folks, it's not so easy for the others. If it's easy for you, lead a project that is close to your heart. And if it doesn't come naturally to you, find people who are excited about writing and make them your allies.
I love it. I love it. You've dug deep into the psychology, right? So if you believe in yourself and go after your passion projects and educate yourself, like you said, I just connected with you on LinkedIn and invited you for the
Yeah.
show, and I've been following your work on LinkedIn and
And
encouraging
likewise.
each other. Yeah, exactly. So same with me. Although I've been a technologist for over 20 years, again, I'm dating myself, but this new ecosystem is super exciting. Just connecting with everybody throughout the world. Like you, I am a Women in AI ambassador, which is an entity in France, and we are all collaborating throughout the globe. And I think we are grateful we are in this internet era where you can reach out to somebody sitting in Australia and they will respond to you. Most
Absolutely.
probably. So just building that network is important. So you highlighted some very, very good points.
Yeah,
So
and just to let you know, I'm an introvert, so it's not easy for me to connect with folks. And if I could connect with so many brilliant people in the last 2 years, I bet any listener is going to connect to even more folks and be able to make even better or more meaningful contributions than I have so far.
Thank you for sharing that vulnerable moment there. But I think you just went after it. Once you knew it's something you want to work on, I think that's the crux of your statement. Basically, if you're passionate, go after and connect with like-minded individuals. So with that note, thank you so much for coming on my show, and good luck with all your projects. I'm sure we'll see each other in the LinkedIn world. And I know you're in Maryland, right? So once all this is behind us, maybe we can meet.
Yeah, thank you for the opportunity, Swati. It was wonderful discussing my experience with everyone. And of course, you are a powerhouse of, energy, the amount of stuff that you do. I'm constantly following you, and I would highly encourage all the listeners to keep following your path forward.
Thank you so
Thank
much
you.
again. Yeah. Bye.
Bye.